Future of fertility has been thrust into the spotlight in Birmingham, Alabama, where the state's largest hospital, known as UAB, has announced it is stopping all in vitro fertilization treatments. It's amid a state Supreme Court ruling that decided frozen embryos are the legal equivalent of children.
The University of Alabama at Birmingham Hospital is pushing pause on IVF, saying in a statement, it must evaluate whether its patients or doctors and our physicians could be prosecuted criminally or face punitive damages for following the standard of care for IVF treatments. Dr. Greg Marchand is a board-certified obstetrician gynecologist, joins us now. Doctor, welcome to National Report. You know, there are a lot of families out there, couples who would love to become parents, and they're unable to conceive naturally. They use IVF as a way to become pregnant. Talk to us about this decision in Alabama. Do you see it expanding beyond the state? Could this have a national impact?
No, I really don't think it's going to have too much of a national impact, and I don't think it makes too much of a change, at least right now in the state of Alabama. This ruling that came out 2 days ago, what it really does is it attaches civil penalties to anybody who's found liable for either negligently or intentionally destroying someone else's embryo. So this is really just Alabama telling us that they value human life very, very high. And I've heard a lot of this being sensationalized on the news, that this is going to result in all IVF being illegal in Alabama, or it could result in, I've heard some crazy things like the possibility of mothers being tried for discarding embryos, being tried for murder, or mothers being forced to have these embryos implanted even if they're genetically abnormal. And I don't think any of that is going to come to actually be. I think all this is really Alabama just showing that if you're going to negligently or intentionally destroy someone else's embryo, we're not going to treat that like destroying their property. Under Alabama's Wrongful Death Act, we're going to treat that like destroying a human life. So I don't think this is something that has a likelihood to spread or become more restrictive.
Yeah, and to catch our viewers up, and clearly you've read up on this. This does stem from a case where 3 couples were looking to sue for wrongful death. That's how this moved forward after their frozen embryos were destroyed, this in an accident at a storage facility. Again, your thoughts here on that. I know that you talked about this being a national conversation, becoming sensationalized, but it has been a topic of conversation now that we've seen one of the major hospitals in Alabama pausing IVF. What type of reaction might see from parents that want to utilize IVF that cannot conceive naturally?
Well, I don't think there's going to be any limitations for those parents. I think it's absolutely reasonable for UAB to pause IVF for a second and take a look at what their policies are. Anytime there's a change in law, a change in ruling, that's going to be a good idea to look at your protocols. But also, as you just mentioned, all this stemmed from an IVF clinic that really didn't have good practices at securing the embryos. A patient was allowed to wander the clinic. Then, as you said, she opened up that drawer of frozen embryos, scalded her hand. The embryos fell to the floor and were destroyed. That's really quite unfortunate. That should never been allowed to happen. So I think it's a good idea for all programs to take a pause and make sure your embryos are secured, make sure areas of your clinic and your IVF laboratories that should not be accessed by patients or the public, make sure these things are secure. So I do think it's a good opportunity to take a pause, make sure the right policies are in place. But I don't see this as a big affront to people that are seeking IVF services in Alabama. I think those services are going to remain available.
Maybe you could just shed some light on what the process would be like for a couple to go through IVF, why perhaps you would have more embryos than you would actually plan on implanting or future children. Explain why there would be some essentially frozen and in storage, and why this is coming to light now.
Well, there's going to be a lot of different reasons to go through an IVF cycle for infertility. In most cases, you're going to have a couple that's going to have embryos that are going to have a higher rate of miscarriage than average, or sometimes people just know within their own genetics that they've got this genetic disease that they want to avoid. Some diseases, for example, may affect only one gender. Other diseases may be able to be detected with a certain genetic test called pre-implantation genetic testing that we can do before we implant the embryos. So it's very, very common to extract a number of eggs from a woman, maybe as many as 20, and then we inseminate those eggs with our partner's semen, and then we're going to do the pre-implantation genetic testing before implantation. So we're going to try to only reimplant those embryos that are going to be genetically normal in order to give that mother the best chance of conceiving what she wants, a live, healthy baby. And in cases like this, unfortunately, the ones that don't have normal genetics, those are often going to be discarded. And you can understand why people under this law might say, well, you know, is there going to be a criminal penalty for this mother now? Or is there going to be a civil penalty? Or will she be forced to implant these embryos? And the answer to this is just no. This is really only applying to somebody else who's coming in and destroying maliciously or by their own negligence someone else's embryo. And I don't think it can any way apply to a mother who's going to just let an embryo with abnormal genetics pass. You know, the same way that you would think about someone who's maybe very, very ill and requiring life support, that tough decision of whether or not to withdraw the life support. Well, it's a very similar situation for an embryo that really is just going to be completely dependent on being frozen at, you know, negative 300 degrees in order to maintain life. So I really don't see any criminal or civil penalties for mothers here, but I do think this is just Alabama showing that they take human life extremely seriously. And if you maliciously or through your negligence destroy an embryo in the state of Alabama, it's not going to be treated like destroying someone's property or medical specimen. This is going to be treated like ending a human life from a financial penalty with civil liability.
All right, Dr. Greg Marchand joining us this morning, really diving deep into this conversation. We appreciate it. Thank you so much.
Thank you.
You got it. As we head to break, a live look